going to need a chair at the bottom of the bed. We're not using the table because, of course, it's infection control, so we'll be using a chair. So on that chair, there'll be a barrier. Of course, you'll have the bedpan. You'll have a chucks or a waterproof barrier. You'll have hand wipes and tissue. You'll have, or toilet paper. And you're gonna have a privacy towel. And of course, 2 pairs of gloves, which you'll be putting on. We're going to be washing our hands at least 4 times, and we will be putting on the gloves twice in this skill. So I'm just going to go ahead and put that in the bedpan. Of course, holding it away, and we're going to begin the skill. Knock, knock. Good morning, Miss Jones. It's Michelle, your caregiver. I'm going to wash my hands. Washing hands. Coming to the bed. Miss Jones, is it okay if I raise the bed so I can talk to you? I'm raising the bed to a comfortable working level. Privacy curtain. Miss Jones, I'm here today to help you, assist you onto the bedpan. Is now a good time? Sure. Okay, great. Patient, I'm going to ask the patient, are they in any pain? Miss Jones, are you in any pain right now? If you have any pain during this procedure, let me know and I'll stop. Patient is currently in a supine position, but I am going to lower the head of the bed. Head of the bed should be down for this procedure. The first thing I'm going to do is, of course, put on Mrs. Jones's privacy blanket. Miss Jones, I'm just going to put this on the lower half of your body, since you already have your shirt on. And I'm just going to go ahead and pull the sheet down without exposing you. And I'm going to also bring your blouse or your gown up. Again, avoiding overexposure. Okay, Miss Jones, I'm going to now put on my gloves, my first pair of gloves, which I'm doing. Of course, during COVID, you will already have your PPE on, but if it's not COVID time and the restrictions have been lifted, you'll just go ahead and put on your gloves. Okay, Miss Jones, I'm just going to go ahead and I'm going to help you bend your knees, okay? And I'm going to say 1, 2, 3, and we're just going to bend your knees up, okay? Ready? 1, 2, 3. Good. Does that feel comfortable, Miss Jones? Are you in any pain? No? Okay. Miss Jones, I'm going to grab the bedpan and the barrier. And I'm going to, you know what, I'm going to change up barriers here. I'm just going to grab this one. It's a little bit bigger. And what I'm going to be doing is I'm going to be placing this underneath you, okay, the bedpan, and at the same time, the waterproof barrier, okay? Miss Jones, I'm going to have you lift your hips on the count of 3. When I say 3, I'm going to have you lift your hips, and I'm going to assist you to lift your hips, okay? And we're going to slide the bedpan under you. Now for this dummy, if you can see her, you're going to have that bedpan just above her hip level, okay? And we slip our hand underneath. Ooh, sorry. Yay, I might have to do this over now. Let me go ahead and do this over. Or can you edit that?
I can edit that. It's okay.
Okay. So, sorry about that. So I'm going to have Ms. Jones just kind of scoot over just a little bit so that I'm not going to drop any bedpan here. So we're going to have her here. The bedpan kind of goes half over. That's what I do. I kind of just put it halfway. And I'm going to go ahead and again, on the count of 3. Ready? 1, 2, 3. We're going to lift her up, sliding the bedpan under, and kind of pushing that barrier through. Okay, and we're making sure she's going to sit on that bedpan. And I'm going to go ahead and spread that out and go to the other side and making sure that that barrier is spread out on this side so we don't have any messes. Okay, so she's comfortably on that bedpan. I'm going to go ahead now and take off my gloves without contamination. So again, pulling at them. And for COVID purposes, if you do have on a gown and gloves, you will not be taking off your gloves, but just voicing that. So I'm taking off my gloves, placing them in the designated trash. And I'm going to go ahead and bring Miss Jones up. Miss Jones, I'm going to go ahead and sit you in a comfortable sitting position. Her knees can be slightly bent. Okay, so she looks comfortable there. Miss Jones, here is your toilet tissue. I would like for you to wipe from front to back, okay? And then these are your hand wipes. After you're finished, you can wipe your hands. Both of these items can go into the bedpan because we are not measuring your urine, okay? So with that, I'm gonna give you also your call light. Can you reach it? Can you press it? Yes? Okay, we're gonna lower the bed. Call me when you are finished. I step out of the room. She's gonna call me, okay? Miss Jones, I'm back. It's Michelle, your caregiver. I'm gonna wash my hands. I'm going to raise the bed. Okay, Miss Jones, are you all finished? Okay, so we're just gonna go ahead and lower her back down. Of course, these items have already been placed in the bedpan. Okay, so when she is again in a supine position, once again, Miss Jones, I'm gonna go ahead and put on my second pair of gloves. So I would be putting on my second pair of gloves. Of course, during COVID, you will already have your gloves on again, so you would just verbalize that you're putting on gloves. Okay. And again, Miss Jones, I'm going to have you raise your legs a little bit, and we're going to go ahead on the count of 3, and I'm going to pull the bedpan out. Now this time I'm going to take this barrier, and I'm just going to place it over the bedpan so that I'm not really touching the bedpan, okay? And I'm going to use this hand to pull and this hand to help to support her. Ready? On the count of 3. When I say 3, you're going to lift your hips. 1, 2, 3. She's lifting her hips, and I'm sliding this out and away from me. I'm also taking the bedpan, and it just slides right down, and of course it's covered up. Okay, so at this point, I could go ahead and have Miss Jones go ahead and bring your legs down. That's great. And at the same time, I'm going to go ahead and bring her gown down. I'm going to go ahead and cover her. I haven't contaminated myself because I did not touch the bedpan at any time with these gloves. So I'm going to go ahead and come down with the towel again. And I'm going to keep it away from me. I'm going to go ahead and place this down and fold it so, making a little package. I'm going to place this in the designated dirty linen. Ooh, designated dirty linen. And I'm going to unwrap, placing this in the designated trash. Okay. And I'm going to inspect the contents for any abnormalities or just making sure that the contents are normal. I'm going to go ahead and place the contents into the toilet. I'm going to rinse, placing it again into the toilet, the rinse into the toilet. I'm going to dry, disinfect, and placing it in the designated dirty supply area. I'm going to take off my gloves, again without contamination, starting with the middle, pointing down. The other 2 hands, placing those in the designated dirty trash. Again, if you're COVID, if you're in COVID attire, you will just verbalize that. I'm going to go ahead and grab Miss Jones's call light. Miss Jones, here's your call light. Can you reach it? Can you touch it? And then I'm going to ask Miss Jones, since she was sitting up when we first came in. Miss Jones, would you like to sit up? No? Okay, great. I'm going to lower bed. Skill complete.